Hello, this is Dr. Amodio, and I'd like to take a moment today to speak with you briefly about what separates some of the things that I do as a holistic doctor versus some of the more traditional medical approaches. And I think one of the big things that people wonder when they go into a doctor's office is what exactly is the doctor going to do to try to figure out what's going on with me? And one of the things that happens is that typically the doctor will not spend very much time trying to understand the cause of the symptoms, the cause of the problems, and instead will try to get rid of the symptoms. Most of the time this is done with drugs, pharmaceutical drugs, and they do a good job of getting rid of the symptoms, but the underlying mechanism is not really addressed. And I think being a holistic doctor, one of the things we try to do is understand the underlying mechanism. Trying to understand what causes the disease or the dysfunction in the body. Being an applied kinesiologist, this is something that we do on a daily basis. We look at what we call the triad of health. The triad of health is a triangle that represents balance in the body, and we look at, if you could imagine, the base of the triangle being the structural issues that the person might be having, or structural imbalance, and then the sides of the triangle being, one being nutritional and or chemical, and the other being emotional or mental. We like to ensure that somebody is balanced all the way around. So if somebody comes in with a particular physical ache, for example, it could be related to a nutritional imbalance. So something as simple as a structural imbalance could have a nutritional imbalance origin or an emotional origin. We know how upset sometimes we get if we're under anxiety or stress, and that can actually cause physical problems. So what's the source of the physical problem? Is it the anxiety, the emotion? So some of the things we do is we try to understand the causative mechanism. We do detailed analysis, we do muscle testing using applied kinesiology that's based on basic science. Everything that we do is based on how the body is put together in a neurological hierarchy to try to understand the mechanism, the underlying mechanism behind why somebody might be experiencing diseases or dysfunction. So thanks for watching today, and look forward to seeing you again.